More coronavirus vaccines are being rolled out today in New York. New York City Mayor Bill de Blasio says more than 40,000 doses are being made available. This comes as New York sees cases rise statewide. Nationwide, Johns Hopkins is reporting more than 16.5 million cases and more than 300,000 deaths from the virus. In New York State, the state is reporting nearly 790,000 cases, with more than 35,000 people having died from the virus. Governor Andrew Cuomo says if things do not improve, he will be forced to close non-essential businesses.
Because if we do not change the trajectory, we could very well be headed to shutdown. And shutdown is something to worry about.
Officials say the statewide positivity rate is more than 5.5%. Joining us now is the Lieutenant Governor of New York, Kathy Hochul. Lieutenant Governor, welcome. Great to have you with us again. Can you talk to the current state of the coronavirus in New York? Where are the hardest hit regions, and what's being done to slow those outbreaks and avoid shutdowns in those areas?
Yes, and thank you for having me back on this show. We've identified what we call microclusters, where the infection rate is the highest in the state in terms of positivity. Right now, that is Western New York. I live in Western New York. My hometown is Buffalo. We're one of the higher ones. Central New York, Syracuse area, Mohawk Valley, which is Oneida heading toward Albany, as well as some pockets in New York City. So we do have about a 5.5% statewide average. But within those pockets, we vary a great deal, anywhere from 4% to 7, 8, or 9%. As much as the numbers are going up, just to put it in context, New York State still remains the 4th lowest state in the nation in terms of infection. So New Yorkers have done a phenomenal job overall. But the death rate is increasing. We're seeing more hospitalization, and that all stems from more people gathering over the holidays like Thanksgiving. So we are very anxious about this upcoming and current holiday season. So that's the focus right now.
And the governor has already suspended indoor dining in New York City to slow the spread of the virus. If more shutdowns do happen, how long do you anticipate they will last? And what kind of support, if any, will people get from the state during the closures?
Well, to answer that question first, it all depends what the federal government will give state and local governments. They have the opportunity on their desk as we speak right now to do the right thing, to make sure that the state of New York has the money to get out to the localities to help them not just handle the pandemic, but also the distribution of the vaccine. That is going to be very problematic if we don't get some support from the federal government. How long a shutdown would last? It's all up to the people of this state. We don't even have to go into a shutdown. The governor is simply saying, this is the path we're on, but it's not preordained that we have to end up in a red zone statewide. That is not what we're hoping to have. Because if people change their behavior, wear a mask, socially distance, get through these holidays with just the people in your immediate family, then there's no reason why we would see an increase in January. But we're preparing for the worst. And we don't just look at infection rates. We're also looking at hospital capacity tied in with the infection rate. And if any area heads above 85% capacity in their hospitals, that's going to be an automatic trigger that we have a problem there. So we've asked all of our hospitals to increase their capacity by 25%, some 50%. So we're getting ready. We learned a lot of lessons. When you go first, and we were hardest hit during this pandemic months ago, we learned a lot of lessons that we can employ now to hopefully avoid a shutdown. The governor was just setting out the warning, this could be what's going to happen, but it doesn't have to be that way.
All right, so let's discuss the state's vaccine distribution plan. Who is being prioritized for the vaccine, and when do you anticipate everyone across the state will be able to get vaccinated?
At-risk healthcare workers in hospitals, they are getting it as we speak. Over 10,000 people received a vaccine yesterday, and we are so proud that the very first person who put their arm out there to do their patriotic duty and let Americans know that this is safe was a healthcare worker, a frontline worker, right from Queens, one of the most diverse places in this country. A woman of color being given this vaccine by a woman of color to just let people know that this is safe and we support this. So that's the first thing we need to do is handle the frontline workers in hospitals. People who work in congregate settings. Think about people in group homes and in areas where people are gathering where the virus is most likely to spread. Then we'll get out to essential workers and people in law enforcement, for example, people that are out and engaging directly with the public. So we have a whole order of priority. What's going to drive that, though, is the number of doses available to us. I can guarantee under Governor Cuomo and our administration, we will have the most aggressive, robust distribution plan anywhere in this country. We've been preparing for this since July, so we know what to do. We have 90 distribution centers. The hospitals are engaged. Plus, we're going to get it out to communities of color where they don't have as much access to health care. There's not a pharmacy on every corner. So we're going to get into the churches and the synagogues and get into public housing, get into senior centers, wherever people congregate. I just left Harlem a few minutes ago. I was engaging with thought leaders there, business leaders, and asking them how they think this is going to go. And there's a lot of mistrust. We have to break through that in order for this to be successful.
Absolutely. That was going to be my next question. How are you doing that? But also what you just described, getting into all of the communities, into the churches, into local areas. When do you anticipate that happening, that phase of the distribution?
The reason we can't give a firm answer is it all depends on when the doses arrive. The first 170,000 New York State relief is received is already allocated in terms of, we know the priorities that's already been expended. We anticipate getting about another 340,000 doses from Moderna, and positive news from Moderna that we expect to have approvals of that from the FDA. So that'll be our next batch. So as the batches come rolling out, we'll be able to get it out. To be really candid, I don't know that we're going to have widespread distribution of this until late spring, even summer. But if there is a change and they're able to produce more and we can get our hands on more doses, we will get them out to people as early as spring.
Absolutely. So I think it's always important to manage people's expectations, because if they know what they have to work towards, they can keep it going until that date. You don't want to make them think it's going to be over too early, because they might let down their guard. Well, Lieutenant Governor Kathy Hochul, thank you so much for joining us. We really appreciate your time.
Thank you very much.